Temporomandibular joint, the TMJ, is the joint between the lower jawbone, the mandible, and the temporal bone of the skull. The TMJ is responsible for jaw movement and is the most used joint in the body. The TMJ is essentially the articulation between the condyle of the mandible and the mandibular fossa, a socket in the temporal bone. The unique feature of the TMJ is the articular disc, a flexible and elastic cartilage that serves as a cushion between the two bone surfaces. The disc lacks nerve endings and blood vessels in its center and therefore is insensitive to pain. Anteriorly, it attaches to lateral pterygoid muscle, a muscle of chewing. Posteriorly, it continues as retrodiscal tissue fully supplied with blood vessels and nerves. The mandible is the only bone that moves when the mouth opens. The first 20 mm opening involves only a rotational movement of the condyle within the socket. For the mouth to open wider, the condyle and the disc have to move out of the socket, forward and down the articular eminence, a convex bone surface located anteriorly to the socket. This movement is called translation.